Hi everyone, my name is Dr. Lade Smith. I am President of the Royal College of Psychiatrists. I am a consultant psychiatrist and currently I'm in charge of forensic services for South London and Maudsley NHS Trust, and I'm responsible for all the acute admissions to forensic services in the whole of South London, actually. And why is that important? It's important because I think this is absolutely uh, germane to why I am absolutely delighted to have been um, elected to be an honorary fellow of the Faculty of, um, of Public Health. And the reason I say that is because 75% of mental health problems arise before the age of 24, 50% before the age of 14. Essentially, once a person has got beyond their childhood infectious diseases, the most likely illness they're going to suffer from as a young person is a mental illness. And in my work, I meet young people, most of them men, who have 18, 19, 20, who have horrendous mental health problems that have really impacted their lives. And a significant proportion of them, when I meet them, and I often meet them unfortunately in prison because they've done something as a result of their mental illness that has meant that they've come into contact with the criminal justice system. And when I meet them and I find out about their lives, I think, if only I'd met you when you were 3, or and then because they've suffered such horrendous abuses or neglect in their lives. And then I think, actually, now I think about it, if only we'd met you when you were a baby, because we could have supported your family more and that would have helped you. And then I think, actually, if only I'd met your mum when she got pregnant with you, because at that point, we could have done so much to avert the likelihood of this young man becoming someone who has become my patient, a forensic mental health patient, when they're 19 years old. That is all about public mental health, because what we know is that about 20% of the outcomes for people with mental illness are related to the clinical work that we do and the clinical care we provide. Majority of the outcomes are related to the social determinants of health. And if we can make a difference to those, the impact on mental health problems would be enormous. It's crucial that we are able to attend to people's levels of poverty, to financial insecurity, housing insecurity, substance misuse in the population, parenting and how people are treated as children. All of these things will make a difference to whether or not they become adults with chronic, relapsing, remitting mental disorder that stops them achieving their potential, interferes with their life chances, and frankly, even interferes with the productivity and economic growth of the country. So I am, as I said, delighted to have been elected an honorary fellow, and I really look forward to working with you all. Thank you.